My name is Yochai Birnbaum. I'm professor of medicine at Baylor College of Medicine, Houston, Texas. In this conference, I'm presenting our work on DAPAGLIFLOZIN, which is an anti-diabetic medication belonging to a new class of drug, the SGLT2 inhibitors. Previous clinical studies have shown that empagliflozin, another drug from this class, reduce total mortality and cardiovascular mortality in a combined endpoint in patients with diabetes without affecting the rate of heart attack and stroke, which is quite unusual because most of the intervention in cardiovascular reduce first a myocardial infarction and stroke, and then the events of mortality. So there is evidence that those class of drugs may affect inflammation and reduce the progression of kidney dysfunction. And we decided to use a mouse model of type 2 diabetes, BTBR mice, to see the effect of this drug on inflammation and progression of diabetic cardiomyopathy. So we took the BTBR mice and wild-type mice and gave them dapagliflozin alone or dapagliflozin with saxagliptin, a DPP4 inhibitor, versus placebo, and watched the animal for 8 weeks. At 8 weeks, we performed an echo, and we sacrificed the animal and checked the heart for markers of inflammation and fibrosis. What we saw that DAPA reduced the progression of diabetic cardiomyopathy and deterioration of the heart function, reduced marker of the inflammasome, the inflammation, and reduced fibrosis in the heart. To further assess the effects, we went to an in vitro model. Cardiac myocytes and cardiac fibroblasts do not express SGLT2. So we wanted to see if there is a direct effect of the drug on cardiofibroblasts that are exposed to lipopolysaccharide. And we showed that lipopolysaccharide increased markers of inflammation, but when we added DAPA, we saw that it blocked the increase in inflammation. Despite the fact that those cardiofibroblasts do not express SGLT2, we thought that it might be related to SGLT1, another receptor close that is expressed in the cardiofibroblast. However, when we use fluorescein, which is a non-specific SGLT1 and SGLT2 inhibitor, we were not able to imitate the effect, and it did not block the effect of the DAPA. So we have now an unknown effect, direct effect, that is independent of SGLT2 inhibition, and we need to do further work to understand what is the mechanism.